I'm an international medical graduate and I graduated from Pakistan and I did also FCP as an anesthesia from Pakistan from your hospital, which is one of the busiest hospital in Pakistan. And on the basis of that FCP as anesthesia, I got the General Medical Council registration. Luckily, at that time, FCP's anesthesia was recognized by the GMC, and I didn't give labs. So right away after completing my FCPS, I only gave OET, and I came to UK in 2020. So that's the brief journey how I reached the UK.
Hmm. And what are you doing right now?
So I'm an ST4 trainee, a high specialty trainee, HE trainee in East of England, Deanery in anesthetics. And I started my ST4 training last year in August. So will be ST5 in August coming. Yeah.
That's impressive. So, what made you choose anesthesia?
So basically, before starting the anesthetic training, doing my house job, actually, I wanted to go abroad. I don't know why, but anyways, so basically, I looked up a few specialities which are like have easy pathways and are like in like a little different, and then you can go to like UK. And my sister was also elder sister was living in the UK, so I wanted to go to UK. So I thought about giving PLAB. And then what happened was that I only gave FCPS part one just like that, that if I pass it, fine. So when I passed that and I started right away training, and then I was like, okay, forget the PLAB. Because when you get started in training in Pakistan, it's just really, really hectic, and then you just forget it. So that's how basically I came into anesthesia. You can say this was luck, but yeah, I did get fascinated with anesthetics when I was doing the surgical internship in Pakistan, and it was like a different field because in the medical colleges we don't get a lot of
Hmm.
exposure in anesthesia. And I remember we used to run for all the anesthetics classes in third and fourth year. So yeah.
How was your transition from working in Pakistan to working in the NHS?
It was, I mean, it was good and a little challenging as well. You can say both things. Because I came in 2020 and COVID happened, and my
Hmm.
first job was Guy's and then Thomas in London, which is the busiest hospital, and it was
Hmm.
a clinical fellow job in intensive care unit. So ITU, COVID, and Guy's and St. Thomas. So it was a big combo. So it was a really overwhelming experience for the first 6 months, and I had no clue what happened in the first 6 months. And after that, I really got alive, and then I was like, okay, what I need to do next? So that was the first experience. And yes, because the Pakistan, because I had worked already in anesthetics, so
Hmm.
I had some background experience, which really helped me in the UK, and it was easy for me to get jobs. Before coming to here, I was shortlisted for a lot of jobs, and but then I was like, guys in St. Thomas had a good reputation and was paying me good salary, so that's what I chose when I came here. So yes, experience did help me. And then because in Pakistan as well, I had worked in a busy hospital, and also I was doing part-time as well in a few private hospitals, so I had a variety of experience. But yes, NHS is still very different because we use a lot of computer information technology. Over there we used to use to paperwork, so you need to get complete with that. And then the NHS guidelines are very different as well. So the whole culture and the system of NHS is definitely very different. So you need time to adapt with that as
Hmm.
well.
Thank you so much for your insights. So, at your time, it was different, but can you tell us about what is the training pathway for anesthesia right now?
So basically you can get into anesthetics two-way. Like, for me, it's like I went to the high specialty training directly from
Hmm.
ST4. I think you can enter into core training, or the ACCS pathway if you're junior, and then do the core training, which is like 3 years, ST1, 2, and 3, and then apply again for ST4 to the high specialty program pathway. That's one pathway. The
Hmm.
other pathway is basically you can do Caesar, which I could have done because there are two pathways which I could have done because I had experience. For Caesar, you must have done any exam, which is recognized by the General Medical Council, and you have to work in a different hospital, either do your own Caesar or do a Caesar program. There are like few Caesar programs which been running in the UK. One is Imperial, one is my hospital, Cambridge, Edinburgh also does a Caesar program for 2 years. The others like Barts and few others. And I've worked in Imperial, so I've been part of the Caesar programs. That's really good, which I would recommend if anyone senior wants to do that. Follow that, so you can do that. For juniors, that's the long pathway. That's like any other specialty, like a 7 year pathway. So
Hmm.
you do the core and then you have to do the higher specialty thing. Anyone coming from abroad as well, like me, can also enter directly into ST4 like I did. But
Hmm.
you have to you have to show evidence about your alternative pathway competency. It takes a lot of time. Took me a lot of time while being in London because London is really competitive
Hmm.
and it's a bit difficult to get signed off, so sadly. So, so basically, it is like for me, I need a stage one in the curriculum to get signed off. And then my primary FRC is another requirement to enter into high specialty training to Westie for. For Caesar, you don't need that. Just need one exam or the final FRCA to come to the UK to do anesthetics. I think sadly FCPS anesthesia, my pathway is closed.
Hmm.
Any FCPS is not recognized at all.
Hmm.
Pediatrics was recognized in a really long time back. Even at my time, it wasn't. So nothing is recognized. So if you need to come to the UK, either do PLAB or do the primary FRC, which is again difficult while doing in Pakistan because you do the written over there online. But the
Hmm.
OSCE and the Viva, you need to do it over here, and then you don't get slots for that because while you're in abroad, they don't prioritize that. So that's another thing. And then you can give EDAC. That's another European exam, which a lot of Indians do that to come and get GMC. Uh, or do the FCAI. That's a lot of people also do the Ireland exam, the Fellowship of College of Ireland one. So you can also do that exam.
So all of this was new for me because there is not much online guidance available to get into
Oh,
anesthetics for IMGs.
really?
So everything
Really?
that you told me right now was new for me.
Oh,
Oh.
really? Yeah,
Hmm.
yeah, yeah. A lot of people are doing anesthetics these days, but I didn't know that nobody has any idea. Yeah, so it's like radiology is one of a very nice
Hmm.
field, and overall in the world as well, there's a lot of places you can go with anesthetics.
Hmm.
Every obviously country has different pathway, but the Ireland is one of a really good one in which you have to do FCI. It's a fellowship, a college of anesthesia in Ireland. So that exam with that you can also get GMC. So if you go to General Medical Council website and write the recognized examinations for General Medical Council, so there's a big list that comes out apart from PLAB. So one is PLAB. With
Hmm.
PLAB you can get GMC and do
Hmm.
whatever. But if you want to do another like a specific exam which is related
Hmm.
to anesthetics, so there are like few options like EDAG, primary FRCA, which is a harder one, and then you can do the Ireland one. So
Okay,
yeah,
thank you so much. I think this was literally the most important part of the video
yeah,
because
yeah,
people usually don't know about this.
yeah, yeah,
Thank you
yeah,
so much
yeah,
for giving insight into how to get into the anesthetics training.
yeah.
And what are your thoughts about the saturation in NHS these days? What are your thoughts about that? What will you suggest to the international medical graduates?
So it's overall, it's a lot of saturation. Sadly, I get so many messages about getting attachments in my hospital. Problem is in anesthesia, a lot of people haven't worked in anesthesia, so nobody really gives you attachment in anesthetics because they're like base experience. And even with a job, I've tried to get juniors a job in anesthetics, but the problem is there's no experience. So without experience, NHS is a bit difficult to get in. So if you come with a little experience, so if you're waiting for the exams to you clearing your exams, just work in anything in Pakistan. I know nothing really helps here, like in paperwork wise. Like my experience back home really didn't work anywhere over here except that it's on paper, and they knew that okay, she has worked and that's it. And it shows when you work. Then when you work in when the consultant looks at you the first day, okay, she knows what she's doing, and
Hmm.
they get the confidence and they're like okay, fine. So that really helps, and also helps in the job application in the next consecutive jobs as well. So one, I think I would just say that if you're trying to wait for the PLAB 2 exam or any other exam and you're still waiting for your visa, anything, don't sit at home. Please, please, please work. Whichever specialty you want to take in the future. So just build your CV and do experience and do as many courses as you can. Yeah. So because your CV really helps.
Hmm. And one question is that how do you find the anesthesia practices, the training environment different in Pakistan and NHS? What is the difference that you have noted so far?
So first, obviously, is the workload. In Pakistan, we had like crazy amount of workload because I worked in the government hospital. You
Hmm.
know how
I did my
hospital
house
like
job from
days.
there, so I
Yeah,
know
yeah,
how it works.
it was crazy. So yeah, so we used to like do 50 patients on the list on the day, which is like impossible in the
Mhm.
NHS. We have 3 or 4 in the whole day, which we do. And because we have sign-in checks, we have like all these protocols and all these checks. So that's very different. So there's advantage and disadvantages stuff. One advantage is you get a lot of hands-on experience in Pakistan
Hmm.
because you get so much workload. So over here it's a little different. But then you get a really systematic approach on seeing the patients, on your documentation. I'm still not very amazing with documentation. Whenever I get a feedback, it's like, can you please improve document? I'm like, okay, fine, I will. So because the trainees write detailed documentation. If you look at the British trainees documentation, you will see the mass difference between our documentation
Hmm.
and their documentation is like the way they write. So that's, I think that's how they're trained over here. So that really makes a difference. So that's what you learn over here. Your documentation is very important because your documentation will help you if you get in trouble. You're not there in court to defend you. Your documentation will basically
Hmm.
speak. So that's why, yes. So you can't really have shortcuts for documentation. So yes, that's what I learned in NHS. That wasn't really important in Pakistan, definitely, as you know.
Hmm.
And then communication skills as well. Over there, obviously, it's really obviously with the workload, you can't really communicate, really have long communications. You can't sit down and talk to the patients, and then listen to their complaints and other things. So over here, obviously, you have to be more particular with that. So that's also I learned better communication with the patients and the colleagues and the consultants as well. Drugs as well. There are a lot of drugs which are not available in Pakistan still.
Hmm.
We are using anesthetics, a lot of them. And apart from that, but yeah, a lot of Pakistan has also improved. I mean, there's a lot of improvement in Pakistan as well because I also worked in private hospitals, which has a lot of similarities to how NHS works, like National Hospital and Hamid
Hmm.
Latif and all that call groups. So that also helped me.